Hey everybody, so we are here today on Ask the Doctor to visit Dr. Jordan. Now last time we talked to her was last year in July, and now she has a second office here in Woodstock. So we're at the Northside Hospital Cherokee Town Lake campus, and I'm gonna go up and show you guys where her office is located so you can find her. So when you get off the elevator like we just did, she is literally right to your left. That is her office straight right there. Dr. Jordan, thank you so much for being back with us.
Thanks for having me.
Well, let's get started here. The first thing I want to ask you is, what is diverticular disease?
Diverticular disease is a very common disease of the colon. It happens very commonly in the United States because people don't eat enough fiber in their diet. So basically it's outpouching. It's a little balloon that comes off the colon. So the colon is actually made out of 4 layers. And what happens is that inside layer unfortunately pops in between the layers into this little balloon. And they're little, they're tiny, but they can get infected and they can develop complications. And so it's very common for patients just in general to have diverticular disease due to these outpouchings.
And in the vein of diverticular disease, what is the difference between diverticulosis and diverticulitis?
So diverticulosis is just the state of having diverticuli. So one is called diverticuli, multiple diverticulosis, and when it gets infected, it's diverticulitis.
What would you say are the main causes for diverticulitis?
So it is because diverticular disease or diverticulosis, a non-infected state, is just these outpouchings. So I got a little picture, a little colon here to show you guys. So you can see like this is the normal colon. So this is the right colon, transverse colon, descending colon, sigmoid colon. Normally there's these little pouches that come off, and they're actually, on most patients, happen here on the lower part of the colon. So if you look in this view, I don't know if you can see, but it's like just a little balloon. But what happens is that it gets blocked. So the mucus and the bacteria that's in the colon can't get out because it's blocked, and then that bacteria fester and multiply, and then it causes you to get an infection.
In your experience, what are the main symptoms of diverticular disease?
Lots of patients have diverticular disease and are none the wiser. They're fine. Unfortunately, if you start having pain, particularly in your left lower abdomen, then we think that you might have diverticulitis. And so an infectious part of that. So they can have pain, patients can develop diarrhea, sometimes even blood in their stool from having an infected state of diverticular disease.
How would you recommend someone help prevent diverticulitis?
So the key of diverticulitis prevention is fiber, getting enough fiber in our diets. We just don't do it because we live in the States, all of our food is really processed, and then we typically peel our vegetables, roast them, fry them, saute them. It takes all the fiber out of them. On average, as a woman, you should get about 20 to 25 grams of fiber in a diet, and as a guy, you should get about 25 to 30 grams of fiber in your diet a day. Most of the time, most of us only hit about 10. So we're extremely deficient. The problem with taking fiber supplements is that they don't provide enough. Most of them only give you about 3 to 5 grams. So if you have to get up to 30, that's an awful lot of pills. So we have to do it through diet. It can be done, it just takes some effort and some lifestyle changes. The other thing diverticular disease is associated with is with being overweight and not exercising, so which go hand in hand most of the time. So if you can, try to eat healthier and exercise, just the basic good lifestyle things, that can help prevent you from getting an attack of diverticulitis.
What does the treatment plan for diverticulitis look like?
So diverticulitis can be categorized in 2 different categories. One is complicated and uncomplicated. Uncomplicated means that you just have the infection of the diverticular disease. Typically, a lot of those can just be treated with antibiotics. Sometimes it can be really bad and you may need hospitalization where they give you IV antibiotics. And then most of the time patients respond very nicely and they get better and that's it. Unfortunately, there are times when patients can develop complicated bouts of diverticulitis, and that's associated with developing an abscess, which is also a pus pocket, or a perforation where the colon actually pops and poop and pus that are supposed to be inside now are outside the colon. And in those situations, you may require emergency surgery or a procedure where we drain the pus by interventional radiology.
If someone is diagnosed with diverticulitis, do they need surgery?
If a patient has diverticulitis, what we need to figure out is it complicated or uncomplicated? If you have complicated diverticulitis, typically yes, you need to have surgery just because the colon is weak, and we worry that if we're able to treat you conservatively, meaning without surgery initially, ultimately we do recommend surgery down the line so that you don't have to go through it again and hopefully not have a worse situation in the future. So we take out that diseased part, hook you back together again, and then that way you don't have to worry about it. If you have uncomplicated diverticulitis, if you have a few episodes and are treated with antibiotics and you do fine, then typically no, you don't need surgery. But if you keep getting recurrent episodes of these things, then we do think, hey, you may want to consider having surgery so that, one, to prevent potential of getting complicated bouts of diverticulitis, or two, if you keep having to be hospitalized, to prevent just the disease process itself. If you guys have any further questions, please feel to call my office. It's at 770-924-9656. I have offices in Canton near Northside Cherokee Hospital as well as in Town Lake. Thanks so much.
Well, Dr. Jordan, thank you so much for being back with us. And folks, this has been Ask the Doctor, and I've been your host, Will Cooper.